In a nutshell, the opioid tracking and monitoring system is a system that allows us to be able to, in real time and across the entire nation, be able to adjudicate eligibility for opioid monitoring, opioid prescriptions that are issued to patients.
First of all, we actually developed the system based on some work that we had done at NATO about 2014, where we certified a fairly extensive system that was designed to track between the 28 nations of NATO and their command and control technologies, to include healthcare. So in bringing that back in 2015 to the United States, this very robust infrastructure was able to use it to secure healthcare information across the nation, where we actually touch every point of sale pharmacy in the United States. We actually turn around a question to us in 20 milliseconds or less, which is about 5 per second. And we do that at a scale of 1,200 simultaneous users. So we're scaled to be able to handle every opioid transaction in the United States.
Today, the nation is facing the tragic impacts of well over 100 opioid deaths every single day. And the White House recently announced that the true cost of the opioid epidemic now exceeds $500 billion a year.
And if you just look at it from a mere standpoint of the Department of Justice, there are illegal opioid transactions that happen across the United States every single day. And a system that monitors and tracks the issuance of those kinds of medications and ensuring that they get into the hands of the right people is important from a standpoint of being able to, one, save lives, and number two, from a pure monetary position, be able to ensure that the United States and across the industry is saving money. Opioid monitoring and tracking, this system allows us, again, at every point of sale pharmacy, to be able to adjudicate in real time the eligibility of individuals that have been given prescription by their provider. And so what this really allows us to do is to ensure that those that need the prescriptions for pain are in fact receiving the appropriate dosage and the appropriate prescriptions. And then on the flip side of that is the fact that it can't be used for other nefarious purposes. An individual could not now jurisdiction hop from one pharmacy to another pharmacy if they are looking to abuse the medication. And so the tool really allows the individual patient that truly needs medication today for the pain or the things that they're going through to get what they need, while at the same time ensuring that there is no abuse or any nefarious use of opioid medication across the nation.
That system is actually designed to stop a transaction before a bad transaction happens, whether it's through errors and omissions or whether it's through intentional fraud against the system. And clearly, if that be the case, then whether we import a healthcare solution with an early identifier, or whether that turns into a law enforcement solution as it relates to what the nefarious actors and trying to get them off the streets, that's what it's designed to do.
CenturyLink is a global company. It reaches and touches so many different networks here in the United States and abroad as well.
So with the EagleForce partnership, CenturyLink is able to provide technology solutions to help government agencies meet their responsibility to the public, whether it be to be protecting the well-being of the population through better healthcare monitoring, or enhancing law enforcement's ability to monitor and respond to fraud in real time, or even provide better regulatory controls and oversight on existing programs.
And so the network capability and the national network capability that CenturyLink brings to this, that enables EagleForce and its ability to take its predictive analytics packages as well as other applications and layer that with a broad national and international company such as CenturyLink gives us tremendous opportunity to use the power of predictive analytics in a variety of different industries.
CenturyLink will continue to be that trusted partner for hybrid IT, big data solutions, and now, more importantly, CenturyLink real-time health analytics powered by EagleForce.